Hey gang, glad to be back. Devin and Michaela have compiled some questions that were posed by some of our followers on Facebook or via Instagram, and so we just got through with our drawing for the November winners, and we encourage all of you to continue to participate. We love it if you share our stories with friends, and then obviously get other people that might have an interest in what we have to say to follow us. Got 3 or 4 questions here that I'm going to answer today. These are posed by patients of ours, and the first one was the confusion that arises about plastic and hand surgery associates and what the hand has to do with plastic surgery. Plastic surgeons basically have been utility players within the field of surgery throughout our careers, and where plastic surgery really got its genesis was in World War II, and that was treating burns and war injuries and the likes of that. The hand and the upper extremity is extremely complex. If you think about it, there are a ton of tendons and nerves that go through a very narrow space, and that is our wrist. And there's actually a zone within our hand that's called no man's land. It's where some tunnels that tendons run through, and if you operate there, it's often very difficult to get a good result. And so plastic surgeons were not scared to foray off into this area and operate, because one, if you think about a plastic surgeon, usually has 7 years of postgraduate experience and training before they ever even come out into practice. And so this complex hard area was an area that we embraced. And if you look at our group, Mike Jabalay was actually the president of the Hand Association and the Hand Society back when he was in practice. And so our group always had a big emphasis on hands. And as a matter of fact, one of our partners, Aubrey Lucas, is an orthopedically trained surgeon who does just hand surgery. And then Dr. Eric Wagner, one of my other partners, does a good bit of hand surgery as he has a hand fellowship. All of us know how to do hands. They just happen to have, if you will, a little bit higher pedigree in regards to complex hand things. Routine things, we routinely do. The second question is related to the surgery center downstairs and what the virtues and added benefits that I personally see associated with it. There are really too numerous to count, but the things that top my mind are, number one, the proximity. It gives me an opportunity to have a clinical practice and a surgical practice occur in close proximity to each other. And so if I have a patient that had a problem, or if I had a need to come up and see someone who was visiting from out of town, I can often do it between surgery cases, whereas if I were across town, that was impossible. The second thing is the efficiency. These girls downstairs that work in our surgery center are top notch. We pick for the best techs, the best nurses, the best staffing. And from a patient's perspective, you know, one of the things that's always concerned them, am I going to get good instructions? Well, I know exactly what I need to do. And the surgery center is dedicated solely to plastic surgery. Guess what? You're going to get top shelf instructions. You're going to take home great, written out, detailed instructions that tell you, here's what to do, here's when to call. And then, you know, always remember, we have a physician on call 24/7. So if there was some emergency, we have someone to take care of you. The third was related to what my thoughts are on social media. I love social media. To me, nothing makes me happier than to get positive feedback on something we've posted, or that somebody says, hey, you know, I'd love to see what y'all are going to come out with tomorrow or next week or whatever. Big tip of the hat to Devin. Devin is really good at this. She and I would coordinate. We come up with good ideas, and then some of the ideas I'll come up with, which I've often enough will wake up in the middle of the night and have an epiphany and say, you know, here's 2 or 3 good thoughts that I have. I can then give her the idea, and then she puts the filler in with it. And so a big kudos to her, and a shout out and a thanks for her marketing skills and her talents, in addition to her other talents. And then the last one was, if I had a superpower, what my superpower would be. Devin's was flying. I'm not sure what Michaela's would be. I think I'd like to be a mind reader. I'm kind of a mind reader, but I'd like to fine tune that skill.